This is Swavesey, a village a few miles north of Cambridge. We're here to make a short film looking at how ICT is used at a small surgery. It's a lovely day, but I'm about to go to my local surgery to make an appointment to see my doctor. I've got an ear infection that I picked up when I was on holiday in Cyprus. Got it from in the sea or a swimming pool or something. It doesn't hurt, but in the morning it's blocked up and I can't hear what my wife's saying to me, which is a bit of a problem. So we're going to go along and I'm going to see Dr. Taylor. Hopefully she's going to give me something for it. And while I'm there, I'm going to try and find out the way that they use ICT in the surgery.
Yes, certainly. Any time good for you? Better than any other?
As soon as possible would be great.
Right, okay. You need to be seen today?
If at all possible. It's not urgent, but
11:10.
It's brilliant. Okay, so this is the computer that you use to make the booking.
Yeah.
What else do you use it for?
Well, it's a database, so it holds information on various groups of patients, like diabetics or people with asthma or people with heart problems.
Okay.
It's also used as a word processor.
So if you
patient
want
letters.
sending out letters and letters to the hospital and things like that, yes?
Obviously we can access the internet through here as well.
Okay, what might you use the internet for?
Hospital information, local hospitals, Addenbrooke, Hinchinbrook.
Like opening times, contact information, things like that?
Consultant lists.
Okay. Do you have a website here?
No.
No, it doesn't. Maybe sometime in the future you'll get one, I guess. What do you look for? What are the most important points in an IT system, would you say? Right,
well, obviously it needs to be reliable.
Yeah.
It needs to be secure so that information is protected. Easy to operate, obviously. And give us accurate information.
Okay, so that the information about the patients is up to date and things like that. Okay. What used to happen before you had a computer? How would I have made an appointment 20 years ago?
Somebody would have sat here with a book and a pen and written your name in and written the time in.
And do you think using a computer system is better or worse?
Absolutely.
What's better about using a computer system, would you say?
There's less chance of error.
Okay.
Because the information's there and it's secure. I mean, once it's there, it's on the system. It can't be rubbed out like a pen could be or something like that.
Yeah. And it's quicker to find information on it, presumably. Yeah, I see. What about any disadvantages of using a system like this? Apart from the
power cuts.
Power cuts. What happens when you get a power cut?
We've had a power cut and it's been really difficult because we've just not known who's coming through the door at that point.
At least with a pen and paper, you always had that.
Well, we then revert back to a pen and paper.
Oh, you use the old system then, do you?
Yeah.
Okay, yeah. And did it take much training?
I suppose overall, with the rest of the job, probably 5 or 6 months to feel really comfortable with the whole system.
Really? So that's quite a lot of time, isn't it? And there's obviously the expense of that as well. Which,
but that's using it on a daily basis.
Right, okay. So you would use this every day. And you would say if there is a power cut, then it's very difficult for the surgery to operate.
Yes. Yeah.
I see. Oh, that's great.
Mr. Holdsworth, please. Good morning. Have a seat.
Thanks.
Please. So we didn't keep you waiting too long today?
No, it was fine for once.
And how are things?
Okay, I've got a little bit of an ear infection.
Oh, right.
I picked it up on holiday.
Where have you been?
Cyprus.
The nurse in a week or so, and she can check them for you and do your blood pressure.
Fine.
Would that be all right?
That'd be lovely, thank you very much. If you just got a minute, I'd just like to ask you a couple of questions about the computer system that you use here. How long have you had computerised notes?
About 15 years.
Okay.
So I'll do a prescription for you now, which you can collect in a few minutes. If we've got it in stock, you can have it today.
Okay. That's like a database of drugs that you've got on there, is it?
This is your own personal prescription information.
Okay.
These are your usual medications that you take.
I take a lot, don't I?
Just the 3.
Just the 3.
And then this is the additional extra one I've just prescribed for you.
Lovely.
To double check for allergies, I can look on here and it's a blank page. As far as I'm aware, you've not been allergic to anything. Is that right?
How do you make sure that this information is all kept up to date?
We all have to just put the data in as it appears.
Right.
So if you walked in today and said, look at this rash, I'm on penicillin, is it an allergy? I'd have to decide whether to put it on as a definite diagnosis. Not only can we look at one person's individual records, we can also easily search for information about the whole population of patients that are registered in this practice.
Okay.
So for the 2,000 or 3,000 people that may be in my care, excuse me, it wouldn't be a difficult problem to find out how many had asthma, for example, or how many were on blood pressure treatment. Or if there was a medical scare, for example, a particular drug was dangerous and deemed to be not allowed anymore for various reasons, we could immediately, within a few minutes, have a list of names, phone numbers and addresses of people who appeared to be
very
taking
difficult
that drug.
20 years ago.
20 years ago or 15 years ago, without a computer, we'd have to rely on the dispenser's memory and
going through
the records
to find them all. So this is all done on its one big database that you can interrogate. Data Protection Act, does that affect you as a surgery?
Yes, Data Protection Act is essential. I have a list here actually.
Well, that's very convenient. Could you just read out the things that we've identified that are important as regards the Data Protection Act here?
This applies not just to your GP or your doctor, it applies to the whole organisation. The information that we keep on patients has to be accurate and up to date.
Okay.
It must be kept secure.
That's why you have the system of passwords
that's right.
and nobody can hack into it, things like that, yeah?
We shouldn't keep data on patients longer than necessary. So, also, we have to make sure it's fairly and lawfully processed.
Okay.
And that the records are adequate, relevant, and not excessive. That means mustn't bombard with so much information you can't get out the important things.
Okay,
so it has to be there has to be some assessment of what information goes on.
Okay, so for example, you wouldn't need my star sign or my favourite football team.
Not at the moment.
Not at the moment.
It could become important in the future.
Any other data protection issues?
There's a couple more issues. One is that the data should be processed in accordance with the individual's rights.
Okay.
The information mustn't go to countries which don't have adequate protection for the individual.
Okay, so obviously data protection is
Vital.
Is vital in a surgery
Yeah.
as it is anywhere.
Yeah.
And you would say that you take measures that mean that you comply with the Data Protection Act.
Yes.
Can we order my prescription from here
Yeah.
and go pick it up at the
I've
dispensary?
done the prescription, but what I'd also like, and it should be ready for you now, but what I'd also like to do is set up an appointment if you'd like to say a day.
Hello?
Hello, I've come to pick up a prescription, please.
Okay. Right, Mr. Holdsworth.
Thanks so much.
Saves you the usual drops. Have you got an exemption card or prepayment? Right, okay. Lovely, thank you. Right. Is there anything else?
Yeah, I'd just like to ask you about your computer system. What are the advantages of using a computer rather than just using a paper and pencil for your prescriptions?
Well, it means as soon as the doctors put it through, that it comes immediately through to us in dispensary.
Okay.
And there isn't any problems with deciphering handwriting.
Doctor's handwriting is often difficult to read, I believe.
Yes, particularly if written speedily.
Okay.
And obviously with the computer system, I can also see what we have in stock and the other doses and formulations of the medication.
Okay. What would be the disadvantage of using a database like this for drugs?
Well, obviously it's more expensive to set up, obviously, than pencil and paper, and
Sure.
And there's training involved with getting people used to it in the first place.